I think it's important to appreciate, to express the appreciation of Nigerian people to DFID for the WINN project. No doubt that WINN project has made tremendous, well, let's say modest impact on the nutrition landscape in northern Nigeria. And there are a lot of lessons to be learned, as we have realized in the past 2 days, the meeting in the past 2 days, from the ORI learning exercise. It's been 2 days of information processing, learning, and building capacity, really. Well, I'd like to say that while the program has made a lot of impact, of course, there are room for improvement. And we are hoping that in the next phase of the program, such improvement could be reflected. We look forward to more linkages among the various output programs, linkages between MNCH Week, infant and young child feeding, as well as linkage with the CMAN program, so that there is a point of integration and they're not being operated as individual programs. We also think that it's important for us to have more government participation in the WINN program, more collaboration with government, and if possible, for government to have if government cannot actively participate, for government to have an oversight on how the program is being implemented, especially at the national level. At the sub-national level presently, as it is presently, government participation is in the area of providing the necessary human resources to implement the program. The advantage of more government participation and collaboration is to ensure sustainability, is to ensure ownership, and it will provide the opportunity to build the capacity or to strengthen the capacity of government to be able to replicate such programs in other parts of the country, realizing that the WINN program is a learning, it's based on the theory of change that can be used to catalyze action in other areas where the project is not holding. We're looking forward to the new WINN. That's WINN Plus, like Andrew had put it, to reflect government priorities around the National Strategic Health Development Plans, and also to be based on evidence. Now, the evidence is not that of, okay, nutrition situation in Nigeria is worse in northern Nigeria, so let's take states in northern Nigeria. We want to see a situation where of course, luckily and interestingly, our data have been disaggregated into states. So why don't we look at, if we take 5 states, what are the 5 states with the worst nutrition indices that would also have willing government participation, and see how we can effect changes in order to improve the nutrition in those areas. We are also hoping that new interventions in the new WINN, we might want to look at interventions like like maternal nutrition, like Andrew had mentioned in this presentation, and infant and young child feeding should take a more prominent role. In the last 2 years, more emphasis has been placed on CMAN, that's Community Management of Acute Malnutrition, and maybe MNCH Week, which comes twice in a year, but then IYCF is a missing link, and we want more integration of IYCF into CMAM, not just community IYCF, but facility IYCF, so that we will have a holistic approach. The advantage of that is that it prevents children who have been discharged from the CMAN program. CMAN program takes care of severe acute malnutrition, and in most cases when they are discharged as moderately and acutely malnourished children. And so the IYCF component could, in the absence of a MAM program, the IYCF component could, to some extent, cater for those children in order to avoid them coming back into the back into the CMAN program. And we're also very interested, one of government's strong priorities, and incidentally can actually fit into the program as it runs, is the use of multiple micronutrient powders, MNPs, to address the micronutrient situation, as we are also using the vitamin A approach to vitamin A supplementation to tackle vitamin A deficiency. And this is because we believe that the platform that we have, the MNCH Week, the health facility platform, the gains that have been built around the CMAN program can also provide such platform for distribution and for the implementation of the MNP program in those states that WINN will be interested for implementation. And we also, like I had mentioned, maybe I need to underscore the importance of strengthening the capacity of government to be able to deliver this package. Like Dr. Olori Egbe has said, it's a novel approach that we would also want to see scaled up in around the country, and would like a more active effort at building the capacity of government policymakers, government's capacity to be able to implement, both at the administrative level as well as at the service delivery point. For now, capacity is built around the health workers' ability to deliver services, but managing the whole program as a holistic package would be a welcome one. And I also think that we need to also prioritize advocacy around mobilizing resources and also building capacity around such advocacy. The challenge we're having now is we succeeded in creating budget lines. We've succeeded in creating funded, we always emphasize a funded budget line, but it has not translated into actual release of funds. And that's why I agree with Andrew's suggestion and his presentation that we need to strengthen capacity to track resources and to ensure accountability. So the advocacy should just go beyond really creating the funded budget line, but follow through. What strategies can we develop to follow through for release of funds at the sub-national level and even at the national level, and to build around tracking those resources and ensuring accountability. Accountability of both public funds and, of course, the WINN, the funds within the WINN program. And I think also, in talking in line with following through and tracking, we should also begin to think about, we should pay more attention on strengthening the evidence base in terms of providing the necessary data that would inform decision. And which is why we're really very impressed with the fact that the operations research and impact evaluation component is independent, and it is working as part of its output to provide the evidence that feeds into program improvement. And I think that, like Andrew had said, we're really having some data issue. We're having data issues around nutrition in Nigeria. And we look forward to a situation where we could have a nutrition information system, perhaps start in as part of the WINN program for a start, and then we could now build on that for a national nutrition information and surveillance system. By and large, I hope I have not exceeded my time. I want to say that the WINN project has really been a learning one. It's been a good approach, and it's something that we in Nigeria will want to learn from and probably adopt for implementation in other regions of the country, and probably sell the idea to other countries that might be interested. Thank you very much.
Thank you very much, Dr. Chris. Just before we